Thank you, Deputy Presiding Officer, and I thank the member for Aberdeenshire East for bringing forward the motion today for debate on Marie Curie's Great Daffodil Appeal. And I think everyone here today, both in the Chamber and in the public gallery, will have had some experience with the vital work of Marie Curie at some point in their life, and I'm pleased to have had the opportunity to discuss the importance of this care this afternoon. Just last week, I had the privilege of visiting the Marie Curie Hospice in the grounds of Daffodil Hospital in Glasgow. I remember fundraising for the hospice as a pupil at nearby Turnbull High School some years ago, but this was actually the first time I had the chance to see inside the new facility, which opened in 2010. And I was struck in my visit not just by the impressive nature of the facility itself, but the peaceful environment that the staff and volunteers have created for those visiting, often under very difficult and distressing circumstances. The exceptional team there stressed the importance of making patients and their families feel welcome and at ease, and they shared their hope that local people around the hospice use the facility as a community space, stopping in for coffee or lunch instead of seeing it as some sort of daunting or strictly medicalised facility. And I thought that was very important and insightful. Because I was born at Daffodil Hospital, and I remember my gran passing away there in the hospital in 1995, and it was actually quite interesting to reflect on the contrast in which we treat the start of life with the end of life, and it's something that will be a universal truth for us all, and I think it's something we still as a society have a dread of and a fear of talking about, and that was something that was really interesting to be confronted in quite a stark way at the hospice, and it left me with some significant things to reflect on. I was also privileged enough to meet some of the patients receiving palliative care in the hospice. One of the patients has not been far from my mind since my visit last Friday. The patient had dealt with various challenges throughout the course of her life. She told me about those challenges, but she was even more keen to tell me about the positive path she had paved for herself after surviving that trauma prior to her cancer diagnosis. Her 2 boys had grown up healthily, she had moved into her own home, and she was enjoying quality time with loved ones. She said, "I was listening to myself speak to people knowing that it was the real me, and I liked the real me. Then I was diagnosed with cancer." And sadly, I was informed this morning that she had passed away last night. But I know that the care of Marie Curie in her final days brought her comfort and dignity, and that was something that was incredibly important to her. It made a deep impression, even in the few minutes I spent with her. Her story sums up one of the many cruel aspects of cancer. This disease does not care how old you are or if you're at an exciting or positive juncture in your life. We have no control over when cancer throws people's lives into disrepair or chaos, as we heard powerfully from Hayley at the reception in Parliament earlier this week, as mentioned by the member for Aberdeenshire East. It was a deeply moving testimony. What we do have control over, however, is the quality of care that people receive in the wake of a cancer diagnosis. And hospices like Marie Curie and others need our sustained support to guarantee that care. Deputy Presiding Officer, news reports this month indicate that hospice leaders in Scotland expect a £12 million increase in wage bills if they are to remain competitive with the NHS and retain staff are really quite troubling to hear. The reality is that they are most reliant on donations to meet those costs. Marie Curie needs to raise £250,000 per week just to fund its services in Scotland. And for children's hospices across Scotland, approximately 70% of their funding comes from fundraising alone. And in the case of the Accord Hospice in Paisley, 60% of their income depends on donations, whilst their costs have risen by £300,000. Fundraising, which can often be hard to predict, and yearly reviews of what funding is sustainable, makes forward planning and responding to local need a challenge for hospices, and a deeply distressing one at that. I would urge the Scottish Government, therefore, to provide urgent support for palliative care providers, to provide assurance to staff salaries that are competitive with the National Health Service, and to commit to establishing a national partnership with hospices in the longer term so that the sector can deliver sustained and universal palliative care options in line with the needs of local communities. This is a no-brainer. It will save the NHS money, and it will deliver better dignity to all of our citizens who are facing the end of life at that point in their lives. It is important that we look at the appropriate settings for people, that they're not dying inappropriately in acute hospitals. And as I mentioned earlier, cancer is a disease which in many ways we cannot control, and has been mentioned movingly by others. That is even more reason why we should commit to improve the aspects that we can.